Okay, so get this. Imagine, like, your doctor having this virtual assistant,
Uh-huh.
but it can analyze, like, all this super complicated medical data
Yeah.
in seconds
Wow.
to help make faster and more accurate diagnoses. We're not talking about just, basic AI here.
Right.
This is AGI, artificial general intelligence,
Okay.
and we're going deep on how it could change, like, everything about healthcare.
I think what's so interesting is that AGI can maybe take us from reactive care to proactive care.
Yeah.
So instead of waiting till we're sick, what if your doctor could predict health risks
Right.
before you even have symptoms?
And then you could get treatments to prevent ever getting sick.
Exactly. Really preventative.
It's crazy, right? So today we're looking at how AGI could change healthcare from this like one-size-fits-all model to something totally personalized.
Uh-huh.
From, diagnosis to treatment and even like discovering new drugs.
It all starts with precision medicine.
Okay.
Imagine AGI looking at tons of genetic markers to figure out the best drug combo for like your specific tumor.
Wow.
You could minimize side effects and make treatment way more effective.
So it's like personalized just for your DNA. That's incredible. But I mean, how is this actually being used?
Right.
What are some real examples of AGI in healthcare right now?
There are already some really interesting applications. One company is using AGI to make personalized cancer treatments.
Okay.
So their platform analyzes a patient's tumor DNA
Uh-huh.
to find the mutations that are making the cancer grow.
So they can target those.
Yeah. And then they use that info to choose the best drug, or like sometimes a combination of drugs.
To really attack it.
Yeah.
So we're not just talking about the future. This is happening now. What else is out there?
Another company made an AI system that looks at CT scans to see if there are signs of lung cancer.
Okay.
And it's really accurate.
Wow.
Studies have shown that this kind of AI can help find lung cancers early,
Yeah.
which is, really important for treating it successfully.
That's amazing. Early detection is so important, especially for lung cancer. So we're seeing AGI for personalized treatments and better diagnoses. But what about preventing disease in the first place?
Right.
You mentioned forecasting health risks. How would that even work?
So think about it. AGI could look at your medical history, lifestyle, and even your genes.
See if you're more likely to get certain conditions.
Exactly. Let's say heart disease runs in your family.
Okay.
AGI could look at all your data
Yeah.
and say, hey, you should make these lifestyle changes or get these screenings or maybe even start this treatment early.
To reduce your risk.
Right.
Wow. So instead of waiting till you have symptoms, AGI could help us stay ahead of potential problems.
Yeah, it's almost like a crystal ball
Yeah.
for your health.
Wow. And is there anything else AGI could help with?
Oh, yeah.
Like what?
It could completely change how we discover new drugs.
How?
So AGI could go through huge databases of chemicals and biological data to find potential new drugs much faster than we do now.
It would really speed things up.
Yeah.
That's incredible, especially when you think about finding cures for diseases we can't treat now.
Absolutely.
So, we've talked a lot about AGI and what it can do. But how does it actually work?
Yeah.
What makes it different from the AI we see every day?
Well, most AI today is what we call narrow AI. It's designed for very specific tasks,
Okay.
like, facial recognition on your phone or the recommendations on streaming services.
Okay.
That's narrow AI. It's great at that one thing,
Yeah.
but it can't really apply what it knows to other things.
So narrow AI is like a specialist, really good at one thing.
Right.
And AGI is more like a generalist, can learn and do different things.
Yeah, exactly. AGI is supposed to learn and adapt like our brains do.
Okay.
It can look at information from different places,
Uh-huh.
make connections between things that don't seem related,
Wow.
and use all that to solve complicated problems.
And that's why it's so good for healthcare, because the human body is complicated.
Yeah, it's really complex. There are so many systems that all work together.
Exactly.
AGI can look at your medical history, genes, lifestyle choices, even things in your environment.
You get a full picture.
Yeah, it sees the bigger picture, which makes it so powerful.
So AGI is not just processing data faster, it's actually understanding human health
Right.
and using that to make treatments that work for each person.
Exactly. It's about moving away from one size fits all and going towards treatments that are personalized.
And proactive.
Right.
And hopefully more effective.
This is really amazing. It could totally change how we think about healthcare. But for those of us who aren't, like doctors, is there anything we can do right now
Oh, yeah, absolutely.
to use AI for our health?
Yeah. So we're still early in developing AGI,
Okay.
but there are already a bunch of AI tools you can use
Really?
that give you a peek into this future of personalized healthcare.
That's great. These tools use the power of AI to give you insights and support.
For different health needs.
Yeah, all sorts of things.
Can you give us some examples?
Sure. Mental health is one area where AI is already doing a lot.
Okay.
There are AI chatbots and apps to help people with things like anxiety and depression.
Okay, that's great for anyone who wants to use AI now. We'll put some of those in the show notes. But before we wrap up this first part, I want to go back to personalized medicine for a minute.
Yeah.
Can you give like a specific example of how AGI might be used to make a totally personalized treatment plan?
Okay. Let's say we have a patient with diabetes.
Right.
AGI could analyze their blood sugar, their meds, what they eat, how much they exercise, even how well they sleep.
To see a pattern.
Yeah, patterns and trends that a doctor might not see.
Okay.
And then it could make a treatment plan that considers all those things.
Wow.
It might suggest changing their medication dose,
Uh-huh.
or recommend changes to their diet and exercise, or even flag things in their environment that could be risky.
Wow, so it's not just crunching numbers, it's actually understanding the person
Exactly.
and making a plan that works for their life.
Right, and that's what makes AGI so powerful.
Mm.
It's not just about making things more efficient. It's about giving people control over their health in ways we never thought possible.
This is truly groundbreaking. We're talking about a whole new way to do healthcare.
We've only just begun to see what's possible.
Stay tuned for part 2, where we'll go deeper into how AGI could impact global health and make healthcare more accessible, explore the future of personalized medicine, and talk about the role of human oversight in this new era. Welcome back. In part 1, we talked about how AGI is already making a difference in healthcare, like with personalized cancer treatments and those AI systems that can spot lung cancer.
Yeah, really accurate.
It's clear that AGI has the power to totally change how we deal with diseases.
And we've really only just started to see what's possible.
Exactly. One area where AGI could have a huge impact is in global health.
Absolutely.
You talked about this a little bit in part 1.
Yeah.
Can you tell us more about how AGI could make healthcare more accessible,
Sure.
especially in those parts of the world where people really need it?
Imagine a remote village,
Okay.
somewhere where they don't have many doctors.
Right.
AGI could be used to provide basic healthcare there.
How?
Think of a mobile clinic
Okay.
that has an AGI system.
With it.
Yeah. It could diagnose common illnesses, tell people what treatments they need, and even give them the medicine.
That's incredible.
Yeah, like a doctor on wheels.
Wow. But what about more complicated cases?
Right.
The ones that need, like, a specialist?
That's where telemedicine comes in.
Okay.
AGI could connect people to specialists anywhere in the world.
Remotely.
Yeah. So let's say someone in a village needs to see a heart doctor.
A cardiologist.
Right. The AGI system could send all their medical info to that cardiologist.
Like their EKG and stuff?
Yeah. Vital signs, readings, even ultrasound images.
And the cardiologist could see it all in real time.
Uh-huh. And then give advice and recommend treatment right away.
So AGI could be like a bridge connecting patients to the experts they need.
Exactly. No matter where they are.
That could really change things for global health equity.
It could.
Yeah.
AGI could also be really useful for training healthcare workers in these places where resources are limited.
What do you mean?
Well, imagine using AI to create simulations.
Okay.
So medical students could practice doing procedures and diagnosing things in a safe environment.
Virtually.
Yeah, it's like a virtual hospital.
That's pretty cool. It sounds like AGI could make medical education more accessible, too.
For sure. More affordable, too. And it can even help with the shortage of healthcare workers worldwide
How so?
by taking care of some of the routine tasks.
Like what kinds of tasks?
Things like data entry, scheduling appointments,
Okay.
even some parts of diagnosis and treatment.
So it frees up the human doctors.
Yeah, so they can focus on more complicated cases and provide better care to their patients.
We've talked a lot about access to care.
Right.
But what about personalized medicine? In part 1, we talked a bit about how AGI could make treatment plans that are really tailored to each person.
Yeah.
Can we dig into that a little more?
We're moving towards this totally new way of doing healthcare.
Okay.
Imagine treatments that aren't based on what works for the average person,
Yeah.
but on your specific genes, your lifestyle, everything about you.
Wow. That's really personalized.
It is. It's like having a treatment plan that's as unique as your fingerprint.
So let's go back to that diabetes example.
Okay.
How would AGI create a personalized plan for someone with diabetes?
AGI could look at so much data:
Yeah.
blood sugar levels, medication history, what you eat, how active you are, how well you sleep, even the bacteria in your gut.
To see what's unique about them.
Yeah, and find things that a human doctor might miss.
Okay.
And then it could create a treatment plan just for them.
That takes all that stuff into account.
Yeah, it might suggest different exercises, dietary changes based on their metabolism, even point out things in their environment that could be risky.
So it's like having a personal health coach
Right, always looking at your data and giving you
to
advice.
help you stay healthy.
Exactly. And we could do that for other chronic diseases too, like heart disease, arthritis, mental health issues. There's so many possibilities.
It's incredible to think that we might not just live longer, but live better
Yeah, exactly. We're talking about a future where healthcare is more proactive,
and preventative.
right? And where patients are more involved in their own care.
But as we move toward this future with personalized medicine, what happens to human doctors?
That's a good question.
Will AGI replace them?
AGI will definitely change how doctors work,
Yeah.
but
Yeah.
I don't think it will replace them completely.
Yeah.
It's more like a really smart tool that can help doctors.
Like an assistant.
Yeah, it can analyze tons of data, find patterns, make suggestions.
But the doctor still makes the final call.
Exactly. Because you can't replace the human touch in healthcare.
So it's more of a partnership
Yeah.
with AGI doing the heavy lifting with data
Right.
and doctors focusing on the human side of things.
Exactly. Like
Yeah.
empathy and building trust with their patients.
That makes sense, especially with those complex cases that need a human's judgment and intuition.
Absolutely. The best decisions come from data and experience.
So AGI provides the data,
Hmm.
and doctors know how to use it for each patient.
Right.
It sounds like AGI isn't just changing how we do healthcare, but the whole relationship between doctors and
No,
patients.
that's a great point.
With AGI doing a lot of the work, doctors will have more time to spend with their patients,
they've got-
to build relationships, answer their questions, give them support.
It's a shift towards putting the patient first.
And how do you see the role of the patient changing
I think patients will be more empowered and informed.
because of AGI?
Yeah. They'll have access to more information and insights about their own health, and they'll be able to make better decisions. It's not about doctors telling patients what to do anymore.
It's more of a collaboration
Right. Patients and doctors working together.
to come up with a plan that works for them.
Exactly. Shared decision-making.
This is a really exciting vision for the future of healthcare, but any new technology comes with risks.
That's true.
Are there risks with AGI in healthcare?
Yes, definitely. We need to be aware of the downsides. One concern is that AGI could be misused.
What do you mean?
What if it's used to decide who gets resources or treatment based on algorithms that are biased?
That's scary. We have to think about the ethics of using AGI in healthcare.
Absolutely.
We need to make sure it's fair for everyone.
And that everyone benefits. We need to be very careful about the data that's used to train these systems
And the algorithms.
and the biases that might be hidden in those processes.
So this isn't just about computer science.
No.
We need ethicists, social scientists, policymakers. Everyone needs to work together.
I agree. To make sure that AGI is used responsibly.
This has been a really interesting discussion about how AGI could change global health and personalized medicine.
It has.
But we've only just scratched the surface.
There's so much more to explore.
In part 3, we'll shift gears a little.
Okay.
We'll look at some of the AI tools that are available right now.
Right.
So you can get a glimpse of this personalized healthcare future.
I'm looking forward to it.
All right, so welcome back to our deep dive into AGI and healthcare. We've talked about a lot of amazing possibilities like personalized cancer treatments and even, bringing advanced medical care to like this really remote villages.
Yeah, it's clear that AGI could really revolutionize how we approach healthcare. But as we've been talking about, we need to make sure it's developed responsibly.
Yeah,
Thinking about ethics and making sure it's good for patients.
for sure. And we've talked a lot about the future, but what about right now? You mentioned there are already AI tools we can use that kind of give us a preview of this, like personalized healthcare future. Can we talk about some specific examples?
Absolutely. One area where we're seeing a big impact already is mental health. There are a lot of AI-powered apps and chatbots now that can help people dealing with anxiety, depression, or, other mental health issues.
We talked about that a little bit before, but I'd love to know more. Like, how do these apps use AI to help?
Well, some apps use AI to look at your voice patterns and text messages.
Oh, wow.
And they can spot subtle changes that might mean your mood is changing or your behavior.
So it's like having a therapist who's always checking in on you.
Yeah, kind of. If the app sees something that looks like you're struggling, it can, like, proactively reach out.
To help.
Yeah, offer support, connect you with resources, or even, like, suggest talking to a human therapist.
Okay.
There are other apps that use AI to personalize meditation and mindfulness exercises,
Oh, interesting.
to help people manage stress, sleep better, things like that.
That's amazing. These could be really helpful for people who don't have access to regular therapy
Right,
or maybe prefer to work on things themselves.
exactly. And a big thing is these AI mental health tools are available all the time.
204/7.
Yeah, whenever you need them.
That's awesome. Technology is making mental health care so much more accessible. What other areas are we seeing cool AI innovations in healthcare?
Well, AI is also doing some really interesting things in, like, personalized fitness and nutrition.
Oh, okay.
So there are apps that use AI to look at your diet, how much you exercise, and all your other health data
Uh-huh.
to create a custom fitness and nutrition plan just for you.
So it's like having your own personal trainer and nutritionist
Pretty much, yeah. These apps can track your progress, give you feedback, and even change your plan as you go.
to keep you motivated.
Exactly. And when you add in wearable technology, like smartwatches and fitness trackers,
Oh, right.
it gets even more personalized because it's using real-time data.
That's really cool. AI is giving people so much control over their own health. It's amazing.
Yeah, it really is. And AI is even being used to help people take their medications correctly.
Oh, that's a good one. It's hard to remember sometimes.
Yeah, and a lot of people miss doses. So there are these AI-powered pill dispensers and reminder apps.
Okay.
And they use smart tech to help you stay on track with your meds.
To make sure people are taking them like they should.
Exactly. Some of these systems can even analyze data to see if there are patterns in how people take their medications.
And then what?
Well, they can figure out if there are any problems with taking the meds correctly.
And then, like, alert someone.
Yeah, so doctors can step in early and offer more support.
It's amazing how AI can be used for, like, everything in healthcare, from big stuff to really small stuff.
Yeah, it's really versatile. And these are just a few examples of how AI is changing things right now. As technology keeps getting better,
Uh-huh.
we can expect to see even more creative and personalized solutions.
Yeah, it feels like an exciting time, especially for people who, love technology and what it can do to make life better.
Absolutely. True AGI might still be in the future, but the tools we have now are already making a difference.
Giving people more control over their health?
Yeah, in ways we never thought possible.
Well, it's clear that AI is already changing healthcare in a big way. But as we move forward, it's so important to think about ethics and data privacy and make sure humans are still in control. To make sure AI is used the right way and that everyone benefits.
I completely agree. We have to be aware of the potential risks, but we also have to be excited about the incredible opportunities that AI offers to create a healthier future for everyone.
This deep dive into AGI and healthcare has been pretty mind-blowing. We've seen how this technology could personalize treatment, make healthcare more accessible, and empower people to take charge of their health. But we also talked about how important it is to develop it responsibly and ethically as we move into this new world.
It's been a really inspiring conversation, and I hope our listeners will keep exploring the possibilities of AI in healthcare and, talking about what it means for the future.
Thank you so much for joining us on this deep dive. If you want to learn more about what we talked about today, check out the show notes for resources and links.
And until next time, stay curious and keep learning about all the amazing things happening with AI in healthcare.
Remember, the future of healthcare is something we're all creating. Let's do it wisely and work together to make everyone healthier.